Hey, Polly.
Hey, Greg.
Well, got another one today.
Another podcast?
Yes, another podcast. And today we have the drug overdose prevention program. We have Jennifer Koziol coming on. She's the program lead for that.
Oh, that's interesting.
It's out of the Rhode Island Department of Health.
They're a busy group.
They are. They are. They're doing a lot, making sure that Rhode Island stays on the cutting edge of everything.
I think our numbers are coming down too.
Yes.
Slowly, but they're going in the right way.
That's true.
Yeah.
That's true. So, hopefully she'll clue us in on those numbers, clue us in on, what innovative things that Rhode Island is doing and how we compare to the rest of the country.
Excellent.
All right. So without further ado, joining us today on Totally Preventable, we have Jennifer Koziol, the Drug Overdose Prevention Program Lead at Rhode Island Department of Health. Jennifer, how are you doing today?
Hi, I am well. Thank you so much for having me and inviting me on the show.
That is great. Thank you. Thank you. Thank you. To start it off like we love to do over here at Totally Preventable, can you tell us a little bit about yourself and how you got to where you are today?
Sure. Well, I moved to Rhode Island, I think almost 15 years ago now to Providence, and I actually moved here because I got a job at the Department of Health. So I've been with the department almost 15 years. I got my MPH out in Western Massachusetts at UMass Amherst, and started at the Department of Health in injury prevention about 15 years ago. And that was before we were really in the height of the overdose epidemic. But as years went by, it was getting worse and worse. And in 2015, the Department of Health got its first full federal grant from CDC to focus on overdose prevention specifically. So I was hired to lead that program. And at the time, I think it was just me and 2 or 3 people working on the epidemic. And since then, we've grown so much. My team is about 10 folks working just on prevention. We have a whole team of epidemiologists working on the data piece. And we have a prescription drug monitoring program, a whole team of folks working on that. We have a communications team. So yeah, since 2015, we have grown a lot in numbers and in funding, both from the federal government and then from the state, mostly through the opioid settlement dollars.
Wow. Been busy. You said Western Mass. That's where I'm from. So as soon as you
Oh, really?
Nice.
Oh,
yeah.
So I love Western Mass.
So can you tell us a little bit about the overdose prevention program and its primary mission?
Yes, so the program sits within the Division of Community Health and Equity at the Department of Health. And our overall mission is to prevent fatal overdoses and decrease substance use related harms. So we use data to inform all of our activities. And we do that by partnering closely with the team that I mentioned of epidemiologists at the Department of Health. So using that data, we implement and then evaluate both local and statewide public health interventions to address the overdose crisis. So some of our major activities include partnering with community-based organizations to send peers with lived experience in substance use disorder to overdose hotspots. And they connect with folks and provide those people with basic needs, linkage to care, and harm reduction supplies. We ensure that everyone in Rhode Island has access to naloxone. So naloxone is the medication that reverses an opioid overdose. We provide education about the drug overdose epidemic. We provide prescriber education, and then we work with local municipalities to help them implement local overdose prevention plans.
I have a question.
Yes.
Another one?
Yeah. So it's because it comes up a lot, and maybe you can answer this, maybe you can't. But a lot of times, I hear in different professions that people aren't allowed to administer Narcan. But I know there's a Good Samaritan law in Rhode Island. If a person's profession says that you can't administer Narcan and you're on the clock, can you administer that Narcan? And you may be able to answer this, you may not. This is completely off the cuff.
Yeah, so I mean, naloxone, anyone can get naloxone free of charge through our website, preventoverdoseRI.org. Anyone can go on that site. They have to do a very quick overdose prevention training and have it delivered to their house free of charge. So anyone can get it, and per state law, anyone can administer it, protected by the Good Sam law. That being said, different places of employment could have their own rules, but as far as the state of Rhode Island Department of Health is concerned, yes, anyone can carry naloxone and administer naloxone. And in fact, it's one of the primary missions of my program is to ensure that everyone has access to naloxone. It's extremely safe. There's no harm in having it. There's no harm in administering it if it's not an opioid overdose, and it will reverse an opioid overdose if that is in fact what's happening to the person.
All right. Thank you for clearing that up for me. Now, being one of the smallest states, if not the smallest state, are there any particular challenges that Rhode Island faces when they're combating drug overdoses?
Yeah, so Rhode Island has actually been a model to many other states in the country when it comes to our overdose prevention efforts. We're actually on the cutting edge of a lot of things. So to name a few examples, we are the first state as of this year to have a licensed overdose prevention center in our state. We've been really way ahead of the curve in terms of what we just brought up, which is low to no barrier access to naloxone. We're the first state to have peer recovery coaches in all of our emergency departments connecting with patients when they come in with an overdose. The challenges that we do face are very similar to other states, particularly our neighboring states in New England. So stigma nationally everywhere is still a very real thing. So stigma around substance use disorder is definitely a barrier to a person's ability to reach out for help and to access treatment and recovery. The epidemic itself is constantly shifting. Our drug supply is constantly evolving. So that's another barrier in terms of, we're doing one thing, it's working, and then a new contaminant comes into the drug supply. We're living in a housing crisis right now. So a lot of the clients that we serve may be ready for treatment recovery, but if they don't have a safe, stable, affordable place to live, that's a huge barrier. And then the other thing I would say is staff burnout. A lot of the community organizations that we work in employ peers with lived experience. And the work is, given all the challenges with the different systems in Rhode Island right now and across the nation, it's very easy and very real that our staff are burning out. So we're constantly thinking about ways to support them so that they that we can maintain a behavioral health workforce here in Rhode Island.
I often applaud the peer recovery system or system of care, but I very rarely even think about the burnout.
Yeah, we've seen a lot of it, the past 10 years, especially with COVID. That was a very, very stressful time, and our on the street peer recovery coaches, they didn't stop working. They stayed out there. They shifted the work to adapt to the epidemic. And it's been a rough few years, but they keep doing the work, and we keep thinking about ways we can continue to support them.
Wow.
That's great. Can you tell us a little bit about the data in Rhode Island? Are there any trends or anything going on?
Sure. Yeah, so we've seen fatal overdoses have been increasing since 2014 is really when we started to see them go up and up year over year. They started to increase significantly in 2019, and then I think it was like 2020, 2021, so right around that COVID time, they went way up and then peaked in 2022. The good news is 2023, they started to come down a little bit. We're talking about fatal overdoses. And right now we just have the first 6 months of data confirmed for 2024, and we've seen that trend continue. So they've come down a little bit more in those first 6 months. So we monitor the data very closely. That's where we're at right now with fatalities. The other kind of broadly, the epidemic starting in those early years, 2014, 2015, has been historically driven by opioids. So first it was really prescription opioids. Those have started to taper, and then we really saw illicit opioid deaths go way up. That's when fentanyl started being very, very present in the drug supply. It's from what we're seeing now the past few years, it's potentially a new phase where opioid death rates are coming down just a little bit, but then we're seeing stimulant death rates increase. So we're kind of in this new phase where we're still thinking a lot about opioids, fentanyl deaths, but we also are seeing the stimulant deaths increase. So we're thinking about how we can reach people who use stimulants.
What would be an example of a stimulant?
So stimulant, crack, cocaine, those are the big ones that we see. So we're moving in the right direction overall. Like, it's great to see numbers come down after so many years of them going up, but there's still just a ton of work to be done.
Yeah, it seems like I don't even want to say get a handle on something, but start to figure out how to decrease something, and something else is entered into the mix.
Pops up, yeah.
And you can't drop any of the balls. You just have more balls in the air to juggle. It's
Right, exactly.
yeah.
Now, are you noticing any trends in any particular populations, like throughout Rhode Island, or geographical areas in Rhode Island?
Yeah, so every single Rhode Island city and town is impacted by this crisis. Like, even the first 6 months of 2024, there was at least one fatal overdose in almost every single one of our cities and towns. So everyone everywhere is impacted in Rhode Island. The municipalities that have the highest rates of fatal overdoses are typically Woonsocket, Providence, Pawtucket, Cranston. So those are kind of like hotspots that we invest a lot of resources in. In terms of populations, again, overdose impacts everyone. Right now, early months, first 6 months of 2024, non-Hispanic Black Rhode Islanders were experiencing the highest rate of fatal overdoses. In terms of ages, we're seeing older populations more and more impacted. So even those first 6 months of 2024, 62% of overdoses were impacted those 45 and up. That went up a little bit in the past. It's been 35 plus, but we're kind of seeing an older population more and more affected. And then in terms of sex, we see more men than females die. So first 6 months of 2024, we had 72% of our overdoses were male.
Wow. Oof.
Yeah.
So you just let us know how the rates have been changing over the last 5 years. Do you know why, like what factors could have contributed to the changes in overdose rates?
It's hard to say because it's such a complicated issue area with, many factors. As far as the increase, we think a big reason for that increase is the drug supply. It's become more and more contaminated over the years. Like I said, really spiking in that 2021, 22. Fentanyl was a big driver. It's extremely deadly opioid. So I think that drove the increase in fatalities. As far as the stimulant related deaths, I mean, it's hard to say. You asked about types of stimulants. So I have some data here, and this was new in 2023. That's when we hit the more than half of fatal overdoses involving cocaine. And then in the first 6 months of 2024, we saw those stimulants continue to rise. So any stimulant, or as far as the first 6 months of 2024, 64% of the overdose deaths involved any stimulant.
Wow.
I gotta say, I'm kind of surprised that the highest age category is so old. I don't know, because we deal with a lot of youth here, so I'm just surprised, and
Yeah.
I'm hoping that because the younger ages aren't in that category, that they're going to carry what they know, right, with them, and that is going to keep continuing up, that they're a safer age group, maybe.
Yeah, I was surprised by that too. And that's something that's kind of a new data point that we got for those first 6 months of 2024. So it's definitely something that my program and my team that we're thinking about is how to reach those older adult populations.
Wow. Now, can you describe a few of your key services that are provided?
Sure. So as we know, every single overdose death is totally preventable, name of this podcast. So we work very closely with it. This isn't one agency isn't going to solve this problem, of course. So we're working really closely with all of our partners in every city and town to address the epidemic. Specifically, my program focuses a lot on harm reduction. So we fund community-based agencies throughout the state. Every single week, we meet with these community-based agencies and we look at the data. And then our organizations send their peers with lived experience to the overdose hotspots based on that data to serve folks in that area. So the services they provide are broad. So they link people to care. Well, first of all, the way they provide the services is broad. We're trying to reach as many people as possible. So they have brick and mortar drop-in centers where people just show up. They do a lot of mobile street outreach where they go to places where people are congregating, much easier in the urban areas than in the more rural areas. They offer home delivered services. We also have 24-hour vending machines. So those are available 24 hours a day that people can go and pick up supplies. So some of the supplies they provide are just basic needs: food, water, clothing. They provide overdose prevention education. As I mentioned, linkage to care, and then harm reduction supplies like fentanyl test strips, naloxone, safer smoking kits, clean needles. Kind of the theory is whatever people need, they are there to provide it. And then when and if people are ready for treatment and recovery, they help them navigate those systems. My program also funds a centralized naloxone hub where anyone in Rhode Island can, as I mentioned earlier, get naloxone. So one of our main goals is making access to naloxone as low barrier as possible. And anyone can order that naloxone on preventoverdoseri.org.
I'm always surprised when someone doesn't know where to get naloxone. I don't. We have. It's not coming out of our ears, but we have a lot of it here, and we give it out a lot.
Good. That makes me happy.
And when people are like, I don't know where to get naloxone, or they've had to purchase it from their pharmacy, I'm like, where have you been? Like,
Yeah.
it's everywhere.
You mentioned the vending machines. Is there cost to get items out of the vending machine?
No, there's no cost to the client.
Oh, that's great.
Those are all funded by the state.
Can you share more about your partnerships with local organizations and law enforcement and other people in the community?
Yes. So like I said, all of our work is done in partnership. We work kind of the main central hub of all overdose prevention work in the state is the Governor's Overdose Task Force. So this is you guys probably know, but for your listeners, statewide coalition of professionals and community members. So including law enforcement, including healthcare providers, including people with lived experience. And the task force itself has all of the work of the task force is guided by a strategic plan that's been through many iterations of updates, but it focuses on 4 pillars: prevention, rescue and harm reduction, treatment and recovery. And all 4 of those pillars are informed by data, and they all use a racial equity approach, which is embedded in all the work. So that's really the center of all the activities in the state, and we work very much hand in hand with the task force. And then RIDO and my program itself, we have partnerships through our funded agencies that are really doing the boots on the ground work. So we work really closely with Community Care Alliance. They serve the northern part of the state, particularly Woonsocket. We work very closely with Project Rubber Renew. They are Providence, Pawtucket focused. We work with AIDS Care Ocean State. We also have a close partnership with the University of Rhode Island. They're the agency that is funded to be the naloxone hub. So they get all the kits, distribute them to the community-based organizations, collect all of the data. And then we work really closely with our local community-based organizations at like the town and city level. So the health equity zones and the regional prevention coalitions. The other thing I'll say, which is relevant, I think, to this question is on Wednesday, so February 12th, there's going to be a CODE summit. So CODE stands for Community Overdose Engagement. It's actually the 4th CODE summit that the state has hosted. And the goal of this type of event is to really bring together all of the local partners to talk about best practices in preventing substance use disorder and overdose, and talking about the best kind of approach to implementing a unique local level plan tailored to specific municipalities in Rhode Island.
Wow. That sounds quite interesting. Where is that being held?
Where
It's at the Crown Plaza in Warwick.
All right.
I think that's where it's been out every time, actually. So
everything held in Rhode Island is.
yes, exactly.
So fentanyl continues to be a major driver of overdoses nationwide. What's Rhode Island doing to address this issue specifically?
Yeah, well, it's a job of my program. We don't really get into the supply itself, but it's the job of my program to educate people, particularly people who use drugs, about the risks of fentanyl. So throughout the years, we've had several actually paid public awareness campaigns, educating people on what fentanyl is, what it looks like, how dangerous it is. We do social media messaging. We've done bus shelters, sides of buses, movie theaters. During COVID, we were doing like gas stations and hand sanitizer. So we've had a variety of different campaigns just trying to reach people where they are to educate them about how dangerous fentanyl is. We also do a lot of communication with using professional advisories to alert prescribers, other healthcare providers, anyone that's licensed by the Department of Health to say, hey, this is a risk, please talk to your clients or patients about fentanyl and here's how you can do it. Again, we provide, we promote and provide free naloxone, which includes overdose prevention, education, and training. Again, in addition to naloxone, we also say you can get fentanyl test strips if you want and talk about the dangers of fentanyl. And then we're tracking overdose data, or I'm sorry, we're tracking overdose activity every single day. So every single day, our EPIs are looking at the data, and if there's an increase in overdose activity, we're sending out an alert through various communication channels, and those alerts are typically talking about the risk of fentanyl.
Any new approaches or pilot programs coming down the way that you'd like to share?
Yes, this well, as I mentioned, I think earlier in the podcast, Rhode Island just became the first state in the nation to have a licensed overdose prevention center. So it opened within the past month. Brown University is funded to evaluate that program independently. So it'll be really exciting to see, you know, what the impacts of the overdose prevention center are, and if it works and the data and the evaluation shows that it works, and hopefully, you know, that will be replicated throughout the state. So that's one exciting thing that's happening in Rhode Island. The other thing that I'm thinking about is related to the Code Summit that's happening in a couple of days. We're going to be launching another iteration of the code project itself, where we're going to be providing dollars at the local level for communities to develop their own unique, tailored overdose prevention response plans. So we're looking forward to seeing what the communities come up with. And again, everything will be evaluated. So if we see success in one place, we will hopefully try to replicate it in another place.
Now, we talked about peers earlier in their burnout, but can you explain like the importance and what role peers or people with lived experience play in implementing programs?
Yeah, so yeah, peers with lived experience, it's really critical to all of the services that we deliver. Lived experience, it's really just something that can't be replicated or learned. It's just like a genuine, authentic approach. So what my team tries to do, we have staff on our team that have lived experience. So we consult with them in the development of all of our programming. The community, as I mentioned earlier, the harm reduction agencies that we fund, most of their employees that are doing the direct outreach to clients are folks with lived experience. It's a key priority for them because these folks are able to connect and provide support and empathy effectively and help folks that are going through their substance use disorder, trying to navigate systems. They're just much more effective at supporting them in a really non-judgmental, non-stigmatizing way. The other thing that we do is we tap into people with lived experience more formally in terms of data collection. So we partner with an organization called Pony, and they implement a survey to people who use drugs. And we use the results of that survey to really find out what's going on at the local level. And then we also Pony convenes a group, we call it the People Who Use Drugs Advisory Board. So they're able to consult with that group of people whenever our program or another program needs like boots on the ground guidance on, okay, how's the content of this training? Is it relevant to what's going on out there? So we tap into that group to help inform interventions as well. So yeah, we really rely on people with lived experience. They bring not only subject matter expertise, but usually passion and dedication to the work. And there's a certain level of trust that when they're, connecting with clients, they can develop that certain level of trust that's much more effective in supporting people and helping them navigate their journey to recovery.
How do you address stigma? I know it's huge out in the harm reduction world. I know when
Yes.
we do trainings for Narcan, a common response from people are, I don't need this training. I don't know these kind of people. So my response usually is, you don't know people, like, because anyone can overdose, right? But so what are some techniques that DOH uses to combat stigma?
Yeah, the stigma is definitely real, and it hasn't gone away in the 15 years that I've been doing this work. And it really, it makes it harder for people to access services. There's still a lot of shame, a lot of judgment, embarrassment around the disease of addiction. So we, words matter, definitely. So we're really thoughtful and intentional as we're putting together all of our communications, all of our campaign materials. We're consulting people with lived experience, people who are currently using drugs, to make sure that we're using the right language. We also, one thing that we do to combat stigma is using messages of hope and inspiration. And we do that by tapping into people's personal stories of recovery. So that can be really helpful. And when people, see themselves or see their loved one or see their friend in a hopeful message of recovery. And you can actually see some of those videos that we have created using our trusted messengers on Prevent Overdose RI, again, on the recovery page. And then another thing that we do is we offer very specific trainings and workshops for our partners that specifically address the issue of stigma. It's especially really important for healthcare providers to make sure that they are up to date. And it's not like a one-time training. That's the other thing. We offer and update our trainings regularly and keep reminding people. And then we also have offered trainings on stigma specifically to municipal leaders. So yeah, it's kind of ongoing effort and really focusing on the words and the communications and reminding people that addiction is a chronic disease and like any other disease.
Now, looking into your crystal ball, what would be one or two of the top priorities of the program over the next 5 years?
Yeah, so it depends what the data says. So we're always looking at the data, like I said, to inform where we're going to invest the dollars. A few things that we're definitely thinking about. One is private locations. So most fatal overdoses occur in private locations, and that's been the case for several years. So we're always trying to think of new programming, new interventions where we can address that. We're thinking a lot about people who use drugs recreationally. Historically, it's a really hard population to reach. They don't see themselves as being at risk. And particularly with this contaminated drug supply, they definitely are. So thinking about how we can reach those users. We're thinking about older adults, as I mentioned earlier, and then definitely stimulant users, thinking about how to invest in programs that where we can reach people who are using stimulants as their main drug.
I feel like this might be a loaded question, but what changes in the state or federal policy would help Rhode Island more effectively address drug overdoses?
Yeah. Well, for us, funding is always top of mind. It's always changing. So right now we're currently very dependent on the federal government, particularly CDC, for our program funding. In 2024, we actually received a significant funding cut from CDC. So we had to pivot some of our programming. So we're really hoping that more funding cuts don't happen with the new administration. We're kind of at a wait and see right now. At the state level, we've been lucky enough to receive dollars to support the work from the opioid settlements. So that's been great. However, it's not sustainable. So that's kind of always the little stress in the back of my mind, is that none of our funding is really 100% sustainable. So we're always looking for ways to diversify our funding. So whether it be private foundation dollars is something we've talked about, research grants, or other grant opportunities, that's kind of always top of mind, trying to think about how to diversify and how to sustain funding for these programs.
Now, for someone listening and viewing the podcast, how can they get involved? How can they help? And what actions should they take to support your mission?
So, well, like I said earlier, when we were talking about stigma, it's important for folks really to understand substance use disorder. It's a treatable chronic disease. So people with substance use disorder, they deserve compassion and care like any other person with a chronic condition. We know people can and they do recover. So some things that you can do is learn about substance use disorder, learn about the local resources out there, and then share them with your loved ones. So the easiest place to go, and I've mentioned it several times on the podcast, is preventoverdoseri.org. So that's really the hub where you can see the data, you can see the resources, you can order free naloxone. If you're in crisis and need help immediately, there's the 988 lifeline. So that's a 24/7 connection to train crisis counselors. So call or text 988. That's always available to you. And then if people just want to get involved with responding to the epidemic more generally, again, I would go to Prevent Overdose RI, but you can learn how to get involved with our governor's task force that I mentioned earlier. So that group convenes monthly. It's a big group of 200 plus folks that are passionate about this issue area. And then the task force itself, I think, has like 8 to 10 different working groups right now that are focusing on different issue areas. So whether you want to get more involved with harm reduction, whether you want to get involved with recovery, it's all there. And that's really the best place to connect.
Yeah, terrific. I love that website. It's my first go-to when I need some information about what's going on.
Oh, good. I'm glad to hear that.
Um,
Where it's a work in progress. So we're always open to suggestions. But yeah, it's a great, I mean, that's a place where Rhode Island is, it's an advantage to be such a small place, such a small state, because we're really able to have all the resources there. The partners are there. It's pretty easy to navigate. So it's definitely the hub for all things overdose in Rhode Island.
Absolutely. Thank you for all this great information. It's been eye-opening and hopeful.
You're leaving it on me.
Yeah, you're usually the one that has all the parting words.
I just want to thank you very much, Jennifer, for all this information, as Polly was saying, and thank you for being a guest on Totally Preventable.
Well, thank you for inviting me. It was fun.
Okay.
First podcast under my belt. So
and it happened here.
Thank you so much.
Have a great rest of your day.
All right, you too. Take care.